My name is Jamie Ganske. I'm the Director of Mental Health and Resiliency for the Chippewa School District. I get to set up the mental health supports for the district. One of my favorite things is that I get to network with our community members, meet our community therapists and agencies to create better supports for our students and their family members. We have been able to not only provide school-based mental health, the school district is able to pay for 4 free counseling sessions for all of our students as well as their family members. We also are able to provide 4 free parent coaching sessions. We've had very positive feedback, really good experiences. And so we have community therapists and community clinicians that can come in and do co-facilitated small groups for our students. They can offer consultation to all of our staff members so they can truly collaborate with our staff members to provide the appropriate supports for our students.
Do you have like an approximate number of students or families or both that are receiving the services?
We have over 160 students that we're seeing just in the month of March alone. We have roughly around 5,000 total students. We also help families, keep in mind, set up services as outpatient as well. So this isn't the total number of students that we've helped support. That's just who is seen in our schools.
What does your team look like within the mental health environment?
We are very lucky to have a mental health navigator. Her name is Shannon Larson. So she talks with their family, finds out their needs. She's able to explain all of the different options that are available. She's very knowledgeable with insurance. So if a family is going to utilize any of the free sessions, she makes sure that they go beyond the 4 that we pay for. They get to stay with that same therapist. But again, she's able to explain all of the options. They can talk about school-based mental health. They can talk about outpatient mental health. They can talk about parent coaching, youth coaching, and truly find what is the best fit to meet their needs.
Well, I think the important factor here is parent involvement, helping them, train them on possible strategies and putting in place coping mechanisms. And it's also a benefit for them because maybe they're learning something as well, just as I have.
Absolutely. Some of our families choose more of a family session so that they can work together towards the same goals.
So what kind of unique provider services do you all offer as far as part of coping or training that would be available for a student and their family to take advantage of?
I love that question because we are continually trying to think outside the box. Not only do we offer the traditional school-based mental health, which is your one-on-one therapy session in our schools, we love finding new co-facilitated small groups that we can offer for our students. And so that can be more of like your grief group or your self-regulation. But we've also expanded into some really fun ones. My favorite group that we offer is equine therapy, where we have 3 miniature therapy horses that come into our schools and work directly with our students. So mini therapy horses work really well with our internalizing students. That means your students are typically a little bit more quiet and reserved, not your students with extreme behaviors, very quiet. To see them open up and make friends and get out of their shell, teachers and principals that are just amazed at the transformation these therapy horses can bring for their students. Plus, they're really, really cute.
I heard that there's also opportunities for adjustments within your school through chiropractor services.
Yes, we do offer chiropractic services for our students. We also offer massages for our staff as well.
That is amazing. What can we as adults do to help our children when it comes to mental health?
We can support our students. We can listen to them, reach out and find what is available within your schools to help support the student. If your child is in counseling, you can work directly with the therapist to find out what are the specific strategies that are being worked on during those sessions so that you can bring that home and work on that strategy in the home setting. Coping strategies are helpful for everybody. We've all had a rough few years due to the pandemic, and so make it a very natural support system so that our children feel safe and comfortable working on learning these strategies that we need.
Are you seeing more like anxiety issues, depression issues, both? What seems to be a common?
Anxiety and depression have historically always been the top two. Anxiety is number one year after year after year. Depression is typically two. 2 years ago, if you think back, the adults were really stressed from the pandemic and from COVID, but the students remained resilient. Last year, you could see that both staff and students then became very stressed, overwhelmed. It was interesting to see that there was a big spike in anger and classroom behaviors that all of a sudden popped up last year as a result of COVID. But our data is looking more like it was pre-COVID this year.
Very interesting. But what's something that, if you had a piece of advice for the entire world when it comes to mental health, what would it be?
Oh my goodness, that's a good question. One thing that I am very passionate about is that I want to find a support that fits everyone's needs. You know what? I want options. Maybe this isn't your best fit. Can you go this route? Can you go this route? Because it's not a one size fits all. It's a what works best for you. The other piece that goes with that is having that community feel of support to surround everyone and say, hey, we've got this, we can do this, what do you need? That is a good feeling, because then our stigma isn't there like it is in other places, because you can comfortably talk about the supports you're getting and coping strategies and self-care with each other. And it's a comfortable conversation, not one that you need to be afraid of. It's, this is what we need. This is what worked best for me. Hey, you should try this. This was amazing. And so when you get to that point, it's a really good feeling.
That is awesome. I want to personally thank you for all that you do, and keeping on the good fight for our kiddos, especially when it comes to the mental health issue. And it's okay to be not okay. So,
but it's not okay to not ask for help.
Right. Absolutely. Oh, good addition. Yes. I think that's something that resonates. It should resonate with all of us in some shape or form.
No, thank you. And I want to thank you as well, because you are really helping us get the support, the mental health supports that we need. And I truly appreciate all the work that you're doing around mental health. So thank you.
You're most certainly welcome.